Hi, Ellen. How are you?
I'm good, thank you. How are you?
I'm doing well, thank you. Thank you so much for joining today. I'm so excited to talk to you. My name is Lucia Kaufer. I'm one of the dietitians that works with Dr. Asamoah in her functional medicine practice. And I'll let you just introduce yourself, and tell us briefly what you do.
Yeah, absolutely. So I'm Dr. Ellen Joseph. I'm one of the clinical psychologists at GI Psychology, as well as a partnership liaison, which is a really fancy way of saying that I work hard to help build relationships with GI practices across the country. There are not a lot of gastropsychologists or GI behavioral health providers in the country, and we're really trying to fill that gap. And one way we're doing that is trying to spread the word that these treatments exist and partnering with other practices to understand how we can best support all the providers on those teams and really help patients like those who are listening on the recording today, that all of us kind of play a different role in their treatment, and we really want to all work together to help them experience relief. So it's exciting to be here.
Thank you so much. And yeah, we're so excited to talk to you. We really view you and GI psychology as just like kind of naturally became an extension of our team because we are talking to people in our functional medicine practice, myself, the other dietitian, Olivia, and of course, Dr. Asamoah. In our sessions, we talk to people with chronic GI issues, and Olivia and myself, the dietitians, we really talk about food and how that plays a role. And we're identifying food sensitivities, and we're helping people create that personalized nutrition and meal pattern for themselves. And Dr. Selma is, talking about the medical side of it all and the labs and things like that. But as we all know, we've talked about the gut-brain connection before. Our patients understand the gut-brain connection, but sometimes we want to refer out to the experts like yourself in GI psychology, to really help our patients in tapping into that and helping them heal their gut and be part of their journey and healing their gut through that area.
Mhm.
So we just love working with you and we love referring out to you. We know that they're going to be in good hands. But really the goal, yeah, and the goal of today's recording is to, get some questions answered so that when we do refer out to you, our patients listening can really understand what you do, why they would get services from you, how to get services from you, and how it can really benefit them and their specific goals and objectives and their journey, their health journey.
Absolutely.
So, but
Yes.
I would love to just learn a little bit. Tell us about what drew you to focus on this intersection of gut health and psychology. Tell us a little bit about your background.
Absolutely. So, when I started graduate school, I always found myself drawn to the health psychology world. And probably looking back, there were formative experiences in my life where I saw in people I loved and cared about this really strong relationship between physical and mental health. But then seeing them live within a medical system where that was often separated and siloed, and both parts of that experience not really being adequately addressed together. Because I think often in our world, in our medical world, you go to this provider for this issue and this provider for this issue and this provider for this issue, but truly everything happening in our body and our mind is connected in some way. So as I proceeded through graduate school, I loved working with folks with various chronic and acute medical conditions, because it can really drastically change our lives in a really profound way and start to kind of run our lives, where all of a sudden it feels like these medical conditions are literally the driver of your car, and you end up just being a passenger and hoping that it goes in a direction that feels good to you. And that can be incredibly challenging when you have other things you value and care about, but it feels like things like the GI conditions that you're coping with are really getting in the way. So after all that kind of generalized health psychology training, I found the GI world, and I think a piece that really drew me here is the stigma associated with these conditions. Many folks on this call could probably relate to the fact that talking to people you love about your poop about your nausea, about your vomiting, about your reflux. Like people are like, ooh, TMI, don't tell me about that. So then you're suffering in silence and then thinking that you just have to deal with it. And then again, your medical condition, your GI condition is driving the car. And I really want to get you back in the driver's seat of your car so that it feels like you are living a life that's meaningful to you and valuable to you, while coping with your GI condition, because sometimes we can't fully make these things go away. And we can help you live a really meaningful life. So that's really what helped me get here. And seeing that we have treatments that can really make a massive impact on folks' lives, I think that's just such a privilege to be able to be in a position to help people experience that relief. So that's why I love working for this practice.
That's beautiful. I know we should all be the drivers of our car of life.
Mhm.
Yeah, that's great. And yeah, and I think we all have the same goal is like we just want to empower our patients to with the tools and the knowledge. And like you said, it might not be go away, but at least they feel like it's more in control and they have a handle and they have all the tools they need in their toolbox.
Absolutely.
So, we share similar like patients with similar disorders, right? IBS, gastroparesis, bloating, constipation.
Mhm.
What psychological tools and strategies do you find are most impactful?
Absolutely. So at our practice, we care a lot about our treatments being evidence-based. And I say this because I'm about to tell you about a treatment that you're probably like, what? This one is evidence-based. But that is really important, right? We want to know that these things are effective before we are treating you with them. So these two evidence-based treatments are gut-directed cognitive behavioral therapy, or CBT, which some folks may be familiar with, and clinical hypnosis. So both of these kind of treat different components of that gut-brain interaction that can go awry when we have a GI condition. So CBT, or gut-directed CBT, really targets that hypervigilance that can develop, where it's almost like you have a magnifying glass on your gut, just kind of waiting for that symptom to come, or you're starting to cut out all these different foods or all these different experiences out of fear of symptoms. We work on that through gut-directed CBT to kind of turn down the impact of the brain, of that hypervigilance on your gut experience, because obviously that stress sent to your gut is not going to help.
Mhm.
And then clinical hypnosis helps a lot with that visceral hypersensitivity that we know that can develop with these GI conditions. So clinical hypnosis, not your magic tricks, not your stage shows that you see maybe at different performances or in TV shows and movies. They love to incorporate hypnosis. But when we do it in treatment, we go and help you go into a trance on purpose. And a trance is something that you actually experience as a human every day. So if you're driving to work and kind of lose track of which turns you took and you get to the parking lot and you're like, wait, how did I get here? You were probably in a level of trance. Teenagers, when they're on social media and you're like talking to them and they have no awareness that you're there, that's trance. But what's really impactful about this part of treatment is we're activating parts of your brain that aren't normally activated when we're in a conscious state. And we can experience a lot of healing through those parts of the brain to turn down that visceral hypersensitivity so that those sensations in your gut that have been magnified and distorted get turned down. You actually feel them accurately. So, an example might be if someone here has experienced where every time they feel hungry, they actually feel nausea and they get like really extreme nausea before eating. Well, once you start doing clinical hypnosis and we work on that hypervigilance with CBT, I'll have someone tell me, oh my gosh, I felt hunger again. And it's like, yes, now your brain is appropriately receiving that signal from your gut. So those are our two main treatment approaches.
So cool. So cool. And I love that there is some science behind that now.
Yes, decades of research, actually. It's not something new. It's just something that we know there's a lot of stigma around clinical hypnosis in our society, and it's not portrayed well. So I think because of that, it's not super common for folks to hear of it. So, but yeah, we have lots and lots of research to support it.
Great. I'm glad you explained that because I think that people, they think hypnosis, like, dangling the crystal ball and like, what's going
Totally.
to happen to me? Am I going to say weird things? But that sounds like, I mean, it's not what it is at all. So thank you for
No.
clarifying.
No, they're in control the whole time, and you'll never do anything in hypnosis that you wouldn't do in a conscious state. Like you are fully in control We're just here to guide you along the way.
That's great. And so speaking of, tell us a little bit about, what that guidance looks like, how often you recommend meeting, tell
Mhm.
us about like that journey of working
Yeah.
with you.
Absolutely. So, our goal is for treatment to be short term and time limited. And what that means is when you join our practice, it's not like we're just going to meet for years and years and years on end. The research behind these treatments is that you can experience relief. And at our practice, we see on average about 13 sessions for folks who are coming to see us for a GI concern specifically. Now, you can always choose to extend treatment if you want to work on some long-term mental health concerns that you have going on or other medical conditions. We have the ability to go longer, but it's not necessary. Treatment is weekly, 45 to 50-minute sessions. We are fully remote, so that is on telemedicine, which can provide a lot of flexibility for folks who have, different work schedules or they're trying to juggle different things. We find that can be really effective, and all these treatments are still very effective on that telemedicine platform. But yeah, we see average of 13 sessions, give or take, but you will work really collaboratively with your therapist to figure out what's going to be that right course of treatment for you and how do we help you meet those treatment goals.
Great, thank you.
Mhm.
And outside of, the obvious GI concerns, bloating, constipation, IBS, gastroparesis, you mentioned nausea
Mhm.
around food, around eating. What are other health and GI concerns that people may have that come to you and maybe some out of the box where people might not even realize there could be a connection?
Great question. So, I like to think of this in kind of three different categories. So, one category being our disorders of gut-brain interaction. So, that really big umbrella term that encompasses lower GI concerns, upper GI concerns. It's all the ones that, you do all your testing with Dr. Asamoah, and she says everything looks normal, nothing is coming back abnormal, and you're still having these symptoms, so we want to treat them. Those types of diagnoses. We work with folks with inflammatory bowel disease as well. So more of those structural concerns, or even someone who has GERD, where we have testing to show that there is acid coming up into the esophagus. And there's a component of a relationship with mental health or stress, right? Where you're like, wow, I noticed my GERD is a whole lot worse when I'm dealing with this really stressful situation at work. That's something we can totally help with. We also help with more medically complex conditions like chronic pain or POTS. And we also see folks with ARFID, which is an avoidant restrictive food intake disorder, which we can see hand in hand with some of these GI conditions, where the goal is not necessarily to manage shape and weight, but more so that we're having challenges in our relationship with food out of fear of the consequences. So that's something else that we can treat as well.
I love that. I love that. And it works hand in hand with what we do as
Mm,
dietitians, really. Um,
exactly.
and so what does it look like? How do you collaborate with us then?
Mhm.
Tell us about that collaboration with dietitians, but also with Dr. Samwa and, functional medicine.
Absolutely. So, one thing that we know when treating folks with GI conditions is it's not kind of a one-way street to recovery for everyone. Some folks have that experience, but for many of us, we need a multidisciplinary care team. And if anyone here has read the book Mind Your Gut, you know
Mm.
that Dr. Riel and Kate Scarlatta call this the dream team, right? Where you have the different providers who focus on your care from their different specialties and lenses. I kind of like to think of it like spokes of a wheel. And each person I work with has a different number of spokes, or the spokes are different based on the care provider they need. But we value greatly that interdisciplinary collaboration because we know we're just one spoke in the wheel. And working closely with folks like Lucia, with Dr. Asamoah, with anyone else that they're working with, a pelvic floor therapist or a psychiatrist, or even a primary therapist that they've been working with for years on their long-standing depression, for example, we want to collaborate because we want you as the patient to feel like we're all on the same team. We're all working from this same kind of working hypothesis, and that all of our efforts together feel really coordinated. So, for example, that RFID example I gave, I would work really closely with Lucia to say, what are you all working on in terms of the dietary changes? And then how can I support that with some of the interventions that we're doing so that you feel like, okay, they're working together and this is really coordinating to help you feel relief.
Thank you. Yeah, and I think it's really important just to point out that when we refer out and we say, you've got to work with Ellen at GI Psychology, we're not just, sending you over, we're actually collaborating and working with her. And we know that she's going to be an asset to your team, your interdisciplinary team, because it takes a village, as we all know.
It does. And we want to try to pull the burden off of you as well as the patient to have to communicate with everyone. We can do some of that work too as your providers to help you
Hmm.
feel like, okay, they're talking, they're on that same page, and just to help you feel relief. That's really the big goal.
Well, great. Thank you so much. And so how can we find you? Like where, when we refer our patients out to you, what's the next step for them?
Yeah, absolutely. So, if you all consent to Houston Gastro going ahead and putting in that um, warm handoff referral line, then a member of our admin team will actually reach out to you directly to schedule your free 15-minute phone consultation. If you choose to do it yourself, you can go on our website, gipsychology.com, and go ahead and schedule your free consult. Or you can send an email to our admin team, so admin@gipsychology.com, and they can get you set up. I think that's just a really helpful way to kind of learn more about the specifics of the practice, share the concerns you have, and decide if this is a good fit for you moving forward. So those are probably the best ways to get in contact if you're interested in treatment.
Okay, great. And do you take insurance, HSA card?
Good question. So we are an out-of-network provider, which means we don't take insurance. What we do for folks with the commercial insurances, so this does not include Medicaid or Medicare, we can help you seek out what's called a single case agreement or a gap exception, where you can get our services covered as if we were in network, and that can significantly reduce the cost of treatment. And a member of our admin team can help you navigate that process, gather the paperwork and the necessary information. And we have a really high acceptance rate for those in case that out of network designation feels a little scary financially for anybody who's listening. We do accept HSA cards. That's absolutely something that you can pay with. Any payment that you provide for our services, you will pay up front and then you will get reimbursed by your insurance. So we don't bill or work with insurance directly. Another plug I wanted to put into was for our GI skills workshop. So if you're someone that you're like, I don't really know if I want to dive into this individual treatment yet, I'm not sure if this is the best fit for me. We have a 4-week GI skills workshop. They're 60 minutes each. It's a group format and it's $199 for the 4 weeks. And what we do during that time is start to talk about like, what is this gut-brain interaction? What are ways that we can start coping? We send you a workbook. We also do experiential exercises and record them and send them to you so that after those 4 weeks, you're starting to walk away with a nice foundation to utilize behavioral tools to manage your distress.
Great. And is that a rolling program or can they join anytime?
Good question.
Yeah.
So, um, we're constantly changing the day and time of the group to accommodate different folks' schedules. So what's best is if you go on our website and look at our group therapy options. And I've also sent some handouts to the team as well, so they can share this with you all. Go ahead and submit that you're interested, and then a member of our admin team gathers everybody's availability, and we actually pick a day and time based on when most folks are available. So our goal is to try to capture as many people as possible, and we'll run multiple iterations of the group. So as soon as we have enough people who are interested, we'll run another group and aim to get it at a time that works for your schedule.
Great, thank you. Okay, we will also send that document, that information to you. So it sounds like there's either the workshop option or the individual option. But the workshop is, if you're feeling like you just want to put your toe in right now, figure it out, see if you vibe with it, if there's something that you want to continue on moving forward with the individual. So it's kind of the
Yes,
bridge.
I think that's a great way to describe it. Yeah.
Okay, wonderful. Thank you so much. This has been so helpful, and I hope that it's been helpful for everyone listening as well. But of course, let us know if you have any additional questions. And I hope that you have a chance to work with Ellen and her incredible team at GI Psychology and just continue to, get in that driver's seat.
Yes, absolutely. Thank you so much for having me.
Thank you. Thank you, Ellen.